Ophthalmic change that you see initially in diabetes is what? Is microaneurysms are the earliest change is what you need to remember. Parner has an ophthalmos. Cheapest question. What is the mechanism of Latanoprost? If you take even tomorrow APPG, one question on glaucoma drugs and their mechanism. You have to be 100% sure, doctor. So it is by increasing the uveoscleral outflow that Latanoprost will be working is what you need to basically remember. Can you please make it slightly little, very little low volume, little, just little. Yeah. Now, beta blockers and alpha 2 agonists, how do they act? They decrease the aqueous humour. Muscarinic agonists, they contract the circular fibers and relax the lens and improve the drainage. If you look at the muscarinic antagonists, they dilate the pupil and relax the ciliary muscle and they occlude the canal of Schlemm, and that is the reason any anticholinergic drug is prohibited from being used in patients who have glaucoma. That's the reason if a glaucomatous individual is having depression, which antidepressant is contraindicated, doctor? Tricyclic antidepressants, because tricyclic antidepressants have got an anticholinergic effect, as all of you know very well. If you look at the prostaglandin analog, like Latanoprost, can the online students can punch? There is no echo in the voice, no? Please punch whether the voice is clear without echo, or is there any echo? Yeah. It decreases IOP by increasing the uveoscleral outflow. Yeah, no echo. All right. Is what need to be remembered. Now, a child presented with watering of the eyes, upturned cilia, which is typically called trichiasis. How many answered it as ectropion or entropion? Doctor. Entrance. If you do the same mistake in entrance, real entrance, थोड़ा दिक्कत हो जाएगा. Oculomotor nerve palsy affects, doesn't affect lateral rectus. Even a school going child knows that. Then a recurrent chalazion, you should suspect sebaceous cell carcinoma. Retinoblastoma, most common second malignancy that you see is is osteosarcoma. There is a specific pattern of cataract, very routine question. You know very well, you have congenital cataracts like lamellar cataract, coronary cataract, etc. Rubella and galactosemia, they lead to nuclear cataract. Wilson's disease lead to sunflower cataract. Corticosteroids lead to posterior subcapsular cataract, and etc. etc. Diabetes lead to snowflake cataract. So one type of cataract, ages immemorial, they have been asking the same question. What is the function of keratometry? Corneal curvature is basically discovered by keratometry. Delenfuch nodules are in sympathetic ophthalmitis. Khatam. 10 questions of ophthalmology. Is there any difficult question? Not at all. 10 out of 10 you should get in ophthalmology, no doubt. Next, what is the primary entry portal of shoulder arthroscopy? This is a gullible question. Somebody make a note. Score of stupid questions in Kerala PG 2016. Who will know, doctor? Arthroscopy, posterior portal, anterior portal, ये क्या है? MCH orthopedics entrance है क्या? MBBS level out of syllabus है. So posterior portal. It is the posterior portal through which you will put the portal is what you need to basically remember. Displaced transverse patellar fracture. This everybody, top 100 rankers will all answer. That is, it is tension band wiring which is basically used in order to fix the fracture. Pen test, one question on median nerve, ulnar nerve, radial nerve, brachial nerve, I mean there is no brachial, axillary nerve. So, aayega na, expected na. So, what is Oshner's sign, what is ape thumb deformity, right, and what is paper test, pen test, Froment test, everything you must know. So, it is the abductor pollicis brevis which abducts the thumb. A pen is kept at a higher level and you are asking patient to touch that, for which he has to abduct his thumb, for which you require the abductor pollicis brevis which is supplied by the median nerve, is what you have to basically remember. Similarly, flexor digitorum superficialis and profundus lateral half become paralyzed whenever median nerve is injured, and that lead to Oshner's clasping test. Whenever you are asking them to clasp the two hands, he can't do that. So, how do you test the angle of fixed flexion deformity? This is another very routine question. It's called as Thomas test. In the Hugh-Owen-Thomas test, what you do is you are flexing the knee and flexing the hip towards the belly. If there is any fixed flexion deformity, then the other limb is there, no, that will rise. That is a way to test the fixed flexion deformity. What is the attitude of partial hip dislocation? So typically it is the flexion, internal rotation and adduction is the typical posture. So APPG is going to be image based questions. So they will give image instead and ask what is the possible dislocation that this guy is having. So you should identify internal rotation, adduction, flexion and call it as partial dislocation, which is the most common dislocation in the hip. In physical injuries classification of Salter and Harris, what is Thurston-Holland sign? Liklo. Second idiotic question. Impossible doctor. Salter-Harris के classification ही मालूम होना बोले तो too much है. क्या है MBBS level में आप कुछ भी नहीं पढ़ाते और हमको entrance में सब कुछ पूछते, too much ना. तो this is typically there is a distal radial injury may you get this metaphyseal fragment, the detached epiphysis presents like a metaphyseal fragment in type 2 Salter-Harris, which is then called Thurston-Holland. They will never ask it. Next 20 years until your granddaughter takes entrance, they won't ask it back. But second difficult question. I mean, difficult means illogical, no one can answer this. Parner's disease is which osteo? We know Kienbach, we know Reebok, and you know Ashgood-Schattler. Parner is the very rare cousin of it. It is the capitular osteochondritis is is Parner's disease. Who will answer this question? Who will answer this question? Some students, obsessive compulsive neurosis, knee or entrance, only one thing is going to remain. Bolke obsessively, compulsively prepare, no? Full list, sab kuch batti marke. They will only answer this. If you didn't answer, still you will get in the top 100 ranks. No worries. Okay. So this is how you find the osteochondritis of the capitulum of your humerus. Then that is basically called as Parner. Nidus is osteoid osteoma, sclerotic nidus. Everybody is supposed to know this. Ewing sarcoma is basically a diaphyseal tumor. Osteoid osteoma, Ewing sarcoma are the two classical diaphyseal tumors without which you can't go to entrance without knowing it. Everybody will answer. Now, for which wrist joint fracture, open reduction and internal fixation is required out of all this. Whenever whenever any fracture is intra-articular, if you don't fix it, what happens? It leads to arthritis, which become a great difficulty. That's the reason you need to do open reduction internal fixation case of the Volar and Barton, Volar type of a Barton's fracture. How does a Volar Barton fracture differ from that of the, in this area what fractures occur, even Colles fracture, Smith also is here only. Only thing is the Volar and Volar type of a Barton's fracture, the intra-articular fragment will be there. That's the reason you have to invariably do the internal fixation. Very standard question. Top 100 rankers will correctly answer this. If you didn't answer, you are going to get 101st rank. That means to say. Huh? So, which complication do you see in spinal cord injury? See, during our preparation days, we used to read only Harrison. Oh, Jada Pythium used to be there. Only Harrison. We used to not care, even the guys who used to read Davidson, kind of a academic arrogance used to be there, but ultimately all those Davidson guys only got top ranks. So, but those who used to read Davidson, he used to say, Arey, you read Harrison, I read Davidson. If I try, I can become like you. You try also, you cannot become like me. Right? So, that's how I became topper. He used to say. That means we will never become topper after reading Harrison, he means to say. So, yeah. After a few years, when you meet your buddies with whom you prepared for entrance and your college schoolmates, college mates in MBBS, this 6 to 8 months that you have prepared for entrance will remain forever a story to tell, like Titanic ship crash survivor. Titanic ship, the whole story begins with you